Antidepressants are effective and many more people in the UK could benefit from taking them. That's according to a major study. The analysis of 21 common antidepressants published in The Lancet magazine showed that they were all better at reducing symptoms of acute depression than dummy pills. Let's talk to Dr. Andrea Cipriani, who is the author of today's report. Also with us, Professor Carmina Pariante from the Royal College of Psychiatrists, Sophie Corlett, who is from the mental health charity Mind, and Steve Cullen is with us. Steve used to take antidepressants. Thank you all very much. I'm going to talk to you first, if I may, Dr. Cipriani, because you are behind this study. Tell us what you have discovered.
The long-standing question, was about whether antidepressants work for people with major depression. And it took 6 years to collect all available evidence, but now we can say that antidepressants are effective for moderate to severe major depression in adults. And I think this is good news for patients, carers and clinicians. And
how did you reach this conclusion?
We analyze all available data. When I say all available data, it's not just the published reports of the studies, which tend to be overinflated in terms of the evidence in favor of drugs, but we collected 52% of the data in our analysis are from unpublished data. So this gives us the idea of how robust is the evidence we found. And we compared all the treatments with a quite innovative methodology, which is called network meta-analysis. So we're able to compare all the treatments in the network, one versus the other.
And you found that some drugs were more effective than others, some antidepressants were more effective than others?
Yes, among the antidepressants, they are not all created equal, so some of them are more effective and others are more acceptable to patients.
But effectively you're saying, because of this, actually more people could benefit from antidepressants?
Definitely. We know that prescription of antidepressant is a tricky issue because antidepressants should probably not prescribed to people with mild depression, so the risk of over-prescribing antidepressants to the wrong people still exists. But I think it's much more important to treat people who can benefit from these interventions. And so antidepressants are a tool that should be used in clinical practice together with psychological treatments or other treatments that are proven effective.
Professor Pariante from the Royal College of Psychiatrists, in England alone in 2016 there were 64.7 million prescriptions for antidepressants. And the conclusion of this study is actually there should be more because more people can benefit.
Well, we know that actually most people with depression are not currently seeking help and are not treated. Maybe only 1 in 5 or 1 in 6 people who suffer from clinically significant depression. So people that, because of their depression, have their life is impaired, yet they don't seek help and they don't get the antidepressants. So if we can help them more, then of course we should prescribe more antidepressants. We have to be careful and make sure that we only prescribe antidepressants for people that really need them.
But as far as you're concerned, is this study good news? Does it settle this debate about whether antidepressants really are effective or not for you?
It does.
I mean, you probably already thought that anyway, didn't you? But for everybody else?
Absolutely. So over the last 10 years, there's been this controversy in the field with most psychiatrists and scientists and mental health practitioners would actually trust that antidepressants are effective and beneficial. But, with some controversy from within the field. And I think this now puts the controversy to bed, which is important. First, we can reassure patients who are on antidepressant today or may want to be on antidepressant in the future that will benefit, and these are safe and effective medication. Second, we can understand more and move on to the important questions. As you mentioned, why some antidepressant works better than others. And also, what can we do for people that don't benefit from the antidepressants? There are 21 drugs mentioned in the study, yet some people don't benefit from any of them. How can we help those people? So we can move on to these really important new questions.
Okay. We're going to talk to Steve Cullen and David Healy, both of whom have used antidepressants. Steve, how did they affect you?
Yeah, I think the importance with the antidepressants is getting the right medication for each individual. What works for one person won't necessarily work for the next person. And also, with taking antidepressants, you need a social, a network around you, whether it's a support group, family members. It's okay taking these medication. If you've not got that support network around you, it's not going to work effectively, and vice versa. If you've got the social network around you, you've not got medication, that's not going to work. So you need to balance both to get the maximum effect. That's what's happened to me. When I first started taking the antidepressants many years ago, there wasn't actually working for me. It took a while to get the right medication, and by which time I'd accessed a support group in the community, Cromwell House Users Group, which is based in Eccles, which was set up by a group of volunteers many years ago to help people with mental health issues, depression, schizophrenia, bipolar, and you could all talk about your experiences.
Okay, well, let me bring in Sophie on that. Sophie, call it from Mind, on that point. It's not just about antidepressants, is it, in terms of people recovering or managing acute depression?
No, that's right. And people find different things useful. As the study has said, this is the advice at the moment, and I don't think the advice you would suggest would change, is that for mild to moderate depression, actually the first line of treatment would be talking treatments, lifestyle changes, exercise, all sorts of other things, peer support, as your guest has suggested, all of those sorts of things. And then even for severe depression, alongside antidepressants, it's good to put those things in place. And for many people, taking antidepressants really helps to lift them up enough so that they can begin to engage in some of those other things as well, and then the combination of those things can be what really helps somebody to recover.
David, hello, thanks for talking to us. Tell us about your own experience of antidepressants.
Well, I think you actually may have the experience I have a shade wrong in that I use the pills to treat people. I haven't on the pills, and I haven't used the pills to treat a mood disorder. My concern with the paper is that it's based on ghost-written articles to which, and we don't have access to the data behind these articles. So the findings, to a degree, there's an element of garbage in and garbage out here. We know that a great number of the trials in this area have overhyped the benefits that we may get from these pills and have hidden the harms. Now, I come from this from the point of view of I use the pills. I use treatments like ECT to treat people who are severely depressed. The key thing for me is really getting a very clear picture of what the harms can be, because a great number of these pills, while they can work in the sense of, I mean, they're not placebo, they don't do nothing. They have they work in the way that, for instance, alcohol works. They have a tranquilizing kind of effect. The question really is, do I want people on these drugs long term? And if I'm going to treat them, they need to know what the risks are, and they don't want to have, they oughtn't to be having the benefits overhyped and the risks concealed. Neither the patients I treat nor the doctors using these pills should be put in that kind of position.
Okay, well, let me get some reaction to what you're saying, Professor Healy, from Dr. Andrea Cipriani.
Yeah, definitely. There has to be a balance between benefits and side effects and risks. And the aim of this project was pretty narrow because we wanted to answer a specific question, and we are using the same data set to answer the specific question about individual adverse events. So and in parallel we are also doing an analysis about long-term treatment of depression, so to give the full picture to patients and clinicians. And I agree with Steve that what we need to do now is try to individualize treatment, and having access to individual patient data from the studies will be the way to go. At the moment we have aggregate data, so these are averages. And replying to the GHOST authors, we are very aware of this problem, and this is why it took such a long time to have access to the unpublished data. And as reported in the paper, we gave priority to the unpublished report exactly because what Professor Healy is saying. We know that sometimes, or often in many cases, there might be the published report which is misleading.
Yeah. Okay. Neville has emailed to say this. I take sertraline, I think that's how you pronounce it. Before I started taking them, I was scared even to go out of the door. I would be visibly shaking when getting on the bus. The sertraline has helped me a lot. I still have panic attacks if really bad things happen, but I can go out. And if everything goes as planned, then I don't have a problem. And Lewis says, my mother was addicted to antidepressants for decades. She ended up being effectively tortured by them. Just a brief word about addiction, Sophie.
Yes, addiction's a tricky word because it has a very specific meaning, but very many people find it very, very difficult to come off antidepressants. And that is one of the side effects, and Professor Healy's done a lot of work on that as well, that and different antidepressants can be more difficult to come off than others, and some people find them harder to come off than other people. But people can have these impacts where trying to come off them, you have to sort of taper that process, just like dealing with an addiction. So there are side effects, and it is worth talking through all of those implications with your doctor when you decide to take antidepressants.
Thank you all. Sorry, go on, really quick.
Depression can become a recurrent chronic disorder.
Yeah.
So some of these people cannot stop simply because they would fall ill again.
Yeah, thank you. Thank you
Can I
very much.
comment briefly about addiction? Antidepressants are not addictive. The problem is the withdrawal symptoms if they are stopped abruptly.
Okay, fair point. Thank you very much. Thank you, all of you. Thank you. President Trump says teachers